everyone. Let me introduce myself. My name is Mario Alberto Jose Martins. I'm from Indonesia, from Yayasan Kasih Suwitno. So today I will talk about courage and connectivity in Indonesia. This project I do with Orlando and Dr. Kirti Gadela from NHS in London. Next, here. Sorry. It doesn't work. Oh, yeah. Oh. Okay. Okay, first, how fast-growing HIV epidemic in Indonesia? Nearly 600,000 people living with HIV in Indonesia. It makes the fourth largest population and fourth highest number of new infection per year. It's almost 46,000. It showed dramatically increase in new HIV infection among young urban MSM, transgender females, and sex workers. So to reduce the stigma and discrimination, Indonesia is committed to the global 95% to target to ensure diagnosis, 95% to get the treatment, antiretroviral, and 95% to get a viral suppression, aim to the end HIV by 2030. And Indonesia also support the U equals U principle, which is that the people living with HIV who achieve an undetectable viral load through consistent treatment cannot transmit the virus to others. Here's the trends in HIV prevalence among MSM. IBS indicates an increasing trend HIV prevalence among men who sex men in 2007 until 2024 has been increased from 5.3% in 2007 and 70.9% in 2024. Why? Because digital advance and access to advancing sexual networks in Indonesia, including acute infection, and global trends for recreational drugs use that facilitate risks versus barriers to effective public health. Increasing rhetoric to victimize, shame, and criminalize same-sex relationship. Yeah, because of that, they prohibited laws and regulation to the community. And we also have limited and poor sexual health education in Indonesia. And the impact is they criminalize sex workers, close the brothels, narcotics, and they do anti-pornography and limit sex education in not elementary, junior until senior high school. They're criminalizing sex before marriage. It's being a criminal if you get sex before you get married. And rehabilitation law for people who do drugs. And also criminalizing same-sex relationship, they count as criminals. Yeah. Our organization addressing the HIV epidemic in Indonesia by promoting early testing, antiretroviral treatment, and adherence using digital technology to spread accurate health information. Our foundation runs two platforms, which is Saya Berani and Tanya Marlo. Saya Berani itself focusing on general population. Saya Berani is a campaign that empowers people to seek information and get tests and access the treatment. And Tanya Marlo is provide youth-friendly sexual health education through an active chatbot online, line apps, and active engagement via Facebook, Instagram, X, and TikTok. Throughout 2024, our content reached over 8 million, and our video content achieved over 10 million views in our platforms. Here's our platforms. Tanya Marlo has more than 45 followers on TikTok and 8,000 followers on Instagram. And also Saya Berani has 43,000 subscribers on YouTube and 14,000 followers on Instagram. Because we have the massive resource in our digital platforms, we collaborate with Project Interact, with Okru Interact, and some of university in Indonesia to implementing an HIV test through clinical pathway for consecutive first time and returning clients who came for HIV tests in Global Lido Clinic in Jakarta and Bali Paduli in Denpasar and Ubud, Bali. Community sexual health clinics serving at-risk population, mostly MSM, female sex worker, and client of sex worker. On-site, gene expert system in place. This project targets 77,000 HIV acute screenings during a 12-month period from May 2023 until February 2025. This is the concept of implementing a care pathway to test and treat AHI can improve the HIV care cascade for key population in Jakarta and Bali. First, they have to adherence checker at every screen visit. They have consultation with the counselor, and then if they get risks, they will have get tested by HIV PCR. If their result is HIV positive, immediately the doctor will prescription the ARV, and if their part notification is negative, the doctor will prescription the PrEP. And with our organization, we collaborate with the Project Interact to promote the AHI test in Jakarta and Bali through the digital community engagement. Actually, this is supposed to be explained by Dr. Kertigadela. If I can say, if you have almost like 2 symptoms, like a high-risk score, you should get tested. For example, if you have fever in last 2 weeks and you have CRI in last 6 months, you have as soon as possible you have to get tested. This is the coefficient. If you reach the 1.5, and yeah, we build CheckUpU. CheckUpU actually is the platform direct user to HIV serving NGO sexual clinics in Jakarta and Bali for acute HIV infection. Testing under the Indonesian intervention study to test and treat people with acute HIV infection, which is we call Interact. CheckUpU co-designed through the participatory process combining community and clinical expertise. Talent for website development and digital outreach was directed by our organization, a community focusing on HIV education with a large social media following in Indonesia, as I mentioned before. The digital platform integrates an interactive AHI algorithm for tailored risk assessment, comprehensive educational modules for HIV testing, IRT, PrEP, and STIs, and trust-building content for healthcare worker videos and community stories. CheckUpU ID was launched in May 2024 and promoted via tailored posts on Instagram, TikTok, and X targeting Jakarta and Bali. We present user data including risk assessment, social media engagement, and Google Analytics metrics. Here, the decision tree. First, when they reach the risk assessment, we will identify them from the previews, how their sexual behaviors, and then they will, if they are not risks, they will direct to the Interact AHI info page. If they are risks, they will direct to Interact Clinic. Here's our platform, CheckUpU. CheckUpU is a community-driven digital tools addressing vital HIV and STI education and preventing gaps among MSM in Indonesia. Here's the website. So, from July until September, we promote the website and we get user starting in July has been increased until September. It shows us if we promoting something through the social media, it will get more audience. And mostly our target audience is MSM. This is the result. Almost then 10,000 unique user and 11,000 session recording peaking in July. 4,006 users, and over 20,000 tracked and action. High engagement record on STIs and HIV testing, and acute HIV infection. Because when you talk about HIV in Indonesia, it's still stigma, and yeah, people still blaming you as a sin for you talking about sexual education. So we have limited access to our social media to talking about condom, even PrEP. (1,000 individual users complete the adherence tools. Over than 1,900 total assessment. 39% among those under 25 years old, which is so younger. And 80% is from Jakarta, and 11% is from Bali, and 9% is from another province. And over 100 self-identify as a male, and we identify as man, sex with man. And the rest is female, non-binary, and trans woman. Our posts about Check Up You in our digital platform garnered over than 100,000 TikTok views, over than 100,000 views on Instagram, and over 400,000 impressions on Twitter or X, reaching a combined Instagram and X following over than 30,000. Social media outreach drove significant traffic, contributing to peaks in user engagement from July to September. TikTok's view and Instagram followers enhanced visibility. Here's the engagement. Check Up You engaged over than 10,000 users and over than 1,000 individual risk assessment in the only 3 months. This demonstrates the huge potential of tailored community clinical digital tools working at scale to addressing gaps in HIV prevention and care in Indonesia, and highlights this unmet need. By integrating personalized risk assessment, culturally sensitive but factual, community focused in education and strategic social media outreach, Check Up You engage a risk MSM to vital education and resources. Partnerships with trusted community organizations underscore the importance of leveraging local expertise to combat stigma and enhance outreach. This model provides a scalable impact framework for addressing HIV epidemics and stigmatized and underserved population and globally. Last but not least, thank you. Arigato.